It seems to start with a fever, followed by a dry cough. After a week, shortness of breath means some people need to go to hospital. A small percentage don't survive. Thousands of new cases of the coronavirus are being reported each day, but the World Health Organization says the outbreak can be contained. Others say it could become a global pandemic. In this week's Impact Minds, we're asking, can it be contained, or do we need to think about this virus in a different way? Well, to discuss this, I'm joined here in the studio by David Hills. David is a Senior Director at ARC Workplace Risk, which is helping businesses here to prepare for the virus. In our Paris bureau is Vittoria Colizza, Research Director at INSERM, that's the French National Institute of Health and Medical Research, and Vittoria has just published a paper on the preparedness of Africa. And with us from Annapolis, outside Washington, is Jennifer Nuzzo, an expert on outbreak detection and response for infectious diseases at the Johns Hopkins Center for Health Security. Jennifer, I want to come to you first because I know you think that we need to shift our focus on this coronavirus. How and why?
Yeah, so I think that when we're looking at a situation where we have tens of thousands of cases and we have over 20 countries, 25 so countries reporting cases. Every day we hear about new cases, despite the fact that countries have taken really drastic measures to try to stop the spread of the virus. When we see a situation like this, that sort of raises red flags for us in terms of how effective are our measures going to be to try to keep the virus out of additional countries. We know there are weaknesses in surveillance in many places, even in the countries that are testing for the virus or not testing enough people to truly understand how much virus is in the country. And there are many other countries who are not testing. And so when you have a virus that's spreading quietly and it looks very similar to other diseases and it's spreading very quickly, that makes it very difficult to think about containing. And when we talk about containment, what we mean is that we're stopping the spread of the virus and hopefully stopping it from spreading among humans on the planet.
Vittoria, to bring you in from Paris, do you think that it is right to talk in terms of containing the virus, or should we be shifting our emphasis?
I think in terms of preparedness, we should be ready for something that evolves. This scenario at the moment, it's very hard to make scenario analysis at this moment because the situation can evolve very rapidly. So we saw a number of cases in China that were reported by Chinese authorities to decrease, but at the same time, experts are afraid that this number may increase once again because of people going back to work. So clearly, I think we need to be prepared for a different shift in the epidemic evolution.
David, we are going to hear more from our other experts about the fact this virus may just stay with us. It may not be something that can be eradicated. You're talking to companies about being prepared, and it's always about getting ahead of it, isn't it?
Yep, very much so. I think the major issue that most of our clients have is that they need to actually start looking at resources and, more importantly, information technology. Home working and self-isolation is a way that we're going to have to deal with this. Yeah, we shouldn't be talking about how we contain it. We have to accept the fact that it's a part of our daily life now. This isn't the first, and it's not going to be the last. So we're going to have to start to plan.
As we've seen in China, if you're talking about home working, you're talking about putting quite a lot of resources in to enable that to happen as efficiently as possible.
Exactly, and large businesses are actually, well set up to actually do that. Smaller businesses don't have those resources. So smaller businesses start to have to look at how they actually undertake home working arrangements. But it's not just about that. It's about how you also manage people when they come back to work after they've gone through self-isolation. So it's not just about home working, it's about managing the return as well. So actually making sure that all of your information technology and having appropriate software platforms in place to actually support that particular process.
We'll talk more about these strategies in just a few minutes. But Jennifer, I want to come back to you to ask you about how this coronavirus compares, for example, with SARS, because you were making the case quite powerfully there that this is not likely to go away. We're not going to get rid of it.
Yeah, what we've learned so far, and we didn't know this in the beginning when countries attempted to try to stop the spread of the virus, what we now know is that the virus seems to be capable of producing a range of symptoms in people in terms of how severe they are. The World Health Organization has said that about 82% of the cases that we know of so far are mild. And that is quite different than SARS. SARS tended to be a more severe disease. With SARS, people didn't tend to spread the virus until they were quite ill, which made it really important that there be appropriate infection control practices in hospitals. And once we improved infection control practices in hospitals, we really decreased transmission. But what we're seeing with this virus is that it is spreading much more widely in the general community, and not, though there have been some healthcare worker infections, they're certainly not the majority. So what this means is that the virus is spreading a bit faster, and it's spreading a bit earlier. Some people have even raised the possibility that people can spread even potentially before they develop symptoms. I think there's still an open question about that. Nonetheless, this virus is behaving quite differently than SARS. And unfortunately, the ways in which it is different make it particularly difficult to contain.
Victoria, I see you nodding there. If we're looking globally, which areas do you think are at highest risk right now of their own outbreaks?
Well, clearly we have to put two factors in this analysis. One is the risk of importation that can be evaluated based on the infected areas now in China. And then the other one is also the type of response that countries can provide. Let's say we performed this study looking at Africa in particular because of the weakness of its healthcare frameworks in several different countries. And for example, there, what happens is that we are able to identify countries which are at highest risk of importation. These were, for example, top three were Egypt, Republic of South Africa, and Algeria. At the same time, ranking inside the continent, they are also appear to be among the most prepared to handle the outbreak. On the other hand, you have a layer of different countries in the continent which are at moderate risk of importation but have really high variation in their preparedness and high vulnerability. So this means that if they import cases, it's even more difficult to be able to detect them rapidly, to follow up to possible contacts and suspect cases, and to isolate them before they spread to the community. And this becomes even more important, as Jennifer was saying, when infected individuals can start spreading before showing symptoms, because of course they are impossible to detect.
David, if we're looking at how to deal with it, it's become a fact of life. Some of the points that you make at ARC are about identifying early who's the chief communicator and who makes the decisions. It's kind of having almost a chain of command or a chain of communication very clear everywhere.
You've got to have the resources in place. You've got to be able to communicate with your staff and your customers and your supply chain. So it's really important that you've got somebody who's actually in control. You can't just have one person. That could always fail. So you're going to have a team in place. I think it's really important that people actually start to think about how they plan for this. Get somebody who actually understands the business, who actually understand what the impact could be on that particular business. Understand what could actually happen if we do have to have large numbers of our staff self-isolate for whatever reason. Once they've done that, they can then start to move and actually look at the resources and actually get some policies in place. How are you going to manage people coming back to work? How are you going to manage how you actually tell people, I'm sorry, you can't come into work today? So you have to make sure that you actually look at those particular areas and get something in place. It's a waste of time actually developing those if you don't have somebody who's going to implement them when and if things happen. Once you've actually looked at those particular areas, start to look at actually how you communicate with your staff. And that's really, really important. But base it on the science, base it on the risks that are associated with your business. So you need to actually look at how you actually get information, such as medical information, to staff.
Thank you very much. I want to go back to Jennifer at this point because China's had to deal with it first, Jennifer. We've all looked at Wuhan, we've looked at the way that 18 million people have basically been put on lockdown in central and eastern China. What do you make of the response there, given that all these people are going to have to come back into circulation?
Yeah, so I have been deeply concerned about the approaches that China in particular has been taking. I understand they're under tremendous global pressure to show that they are responding forcefully and fully to this viral threat. But I think when you have a situation where more than 600 million people are under some level of travel restriction, you still see cases growing. There may they're recently reported that the cases are slowing. I find it very difficult to interpret recent data because we know that there's a delay in diagnosis. But nonetheless, if people do not become infected this time, as long as the virus is on the planet and circulating, China is a global economy, the virus will show back up. And so I don't really understand what the end game is for these measures. I do deeply worry about the quality of life and the safety of the people who are under restriction. And I worry about the impact that it has on businesses and the economy, which is not just about money. It's also about making sure we all have the supplies that we need in order to manage this crisis, like personal protective equipment and other medicines. We live in a globalized society, and I'm so glad that we're talking about the private sector readiness, because the private sector is an important response asset in this. We need to keep medical supplies and resources flowing so that people can continue to live and thrive despite the presence of this virus.
David.
Totally agree. And the only way you're going to do that is by actually putting some sort of plan in place. I can't bang on too much about it. Planning is the key here. And resources. IT resources are also going to be the way forward. That's got to be the way forward for all of us.
If I can come back to Victoria now, I suppose one of the issues, and we're seeing that I think with Iran today, Victoria, is that in societies where there is not a great deal of international access, or very rural and far-flung communities, there's a danger that we just don't know what's happening.
Yes, of course, transparency, access to data, of course, is key also for the rest of the world to understand that this is valid for every different country. The same applies also to data in China, for example, understanding also what kind exactly of intervention they put in place is very important to understand what can be done in other countries. Then again, there may be issues also in terms of possible cases that went undetected. So it's not only what we report, but also what we are not able to report. And that's why I agree. Preparedness is the key, because that's the only way that we are able to face whatever is going to happen next.
And Victoria, just in the meantime, a quick thought about the fact that in our age, international travel, frequent international travel, is the norm. Could a virus make us rethink that?
I'm sorry, could the virus?
Do you think something like the coronavirus, especially if it spreads, will make us rethink about the way we jump on planes, you know, the amount of international travel?
Well, that's very hard. For example, there is a long debate about travel restrictions. It's very intuitive to think that travel restrictions could actually work to contain an epidemic, and there are several studies. We made some, but several groups around the world, and there is also empirical evidence for for prior epidemics that unless these travel restrictions are complete, so almost 100%, they will not be able to contain an epidemic, because the containment is really performed by decreasing the number of new transmissions that can be observed every day at the local seed, so at the epicenter of the epidemic. It's not so much and not only exclusively about containing that. Given said that, these type of restrictions have been considered completely unfeasible so far, except for for example, the travel restriction that was put in place in Wuhan, just completely shutting down the airport.
Victoria,
but in that case.
Well,
yeah.
sorry, we're just running out of time, I'm afraid. I just very briefly, Jennifer, want to put to you, even though not to underestimate the gravity of the situation, is there also a danger of overreaction?
Well, I think the amount of global attention this virus is getting is appropriate. It's a new situation. There's still many unknowns, and we don't have the kind of response resources that we would like. It would be wonderful if we had better diagnostics and a vaccine and medicines. For those reasons, I think it's really important that there be global attention to this, and we always have to learn more and collect more data. That said, from an individual calculation, and to your earlier point about should we rethink travel, I mean, we have to continue to live. We can't let this virus change our way of life, and we can't risk responding in a way that is worse than the virus itself.
Jennifer, thank you very much. We will leave it there. Jennifer, Victoria, David, thank you so much for bringing your expertise to our debate.